Welcome to the first of many blogs of Miles to Smiles, an epic charity motorcycle ride through Southeast Asia. So today we're going to talk to volunteer surgeon and passionate Interplast supporter, Dr. Ian Carlisle.
Well, I always had a bent to be doing something surgical, and I trained in dentistry first and then in medicine and then in plastic surgery, both here and in the US. When I got back and started practice, I guess I was really motivated by my mother's words that it always put something back into the community. Interplast at that stage was just starting, and I felt this was an ideal way of being able to share some of the good fortune that I'd had. The first trip I did with Interplast was in 1985 to Fiji, and since that time I've continued to do trips on an annual basis and have found a great deal of enjoyment in terms of working with the teams, with the surgeons and nurses from other countries. I think the hardest cases that we face are ones where we have to make decisions about who we can operate on and who we can't. Basically, we're a guest in another country. Basically, we have a lot of patients that are presented to us for surgery, and each one of those patients' families has hopes that we can perform more than we can. So some of the cases that have got cancers, particularly in the Pacific, where we know at home that we can treat them with a combination of surgery, radiotherapy and chemotherapy, none of the latter is available in these countries. So doing the surgery alone can often be a misfortune, and telling these families that we can't help is really quite difficult. There are many cases that have changed the way you think. I think particularly in what we do here in Australia, the types of patients we treat, there's a whole different set of values as to where we go in some of the rural regions. I think that one of the girls that we treated, called Evie, who you may see some photographs of later, was a young girl born with severe facial clefts, an intelligent girl, but was kept in the village in a hut. She presented to our clinics 3 years in a row. On the first year we arranged for her to go to Jakarta to be assessed by the local surgeons for perhaps treatment in Australia. The family didn't want to travel, she was too scared to travel out of her province. So we made the decision after some discussion that we would operate on her in the rural environment. She got a satisfactory result, finished her schooling, did nursing, got married, and has had a family. So that to me is an experience that has been life-changing for her. I think the satisfaction of being able to change somebody's situation, somebody that is in a situation with something that can be cured, or not cured, but improved with a knife, and that can let somebody that otherwise cannot take part in normal life being able to, particularly in terms of facial deformity, particularly in terms of some nasty contractures with burn scars. They can be quite life-changing for the people involved. Without the assistance of people like Interplast, they don't get anything done. I think the most confronting thing that I've had in an Interplast experience was when we went to Bali in the early 90s, after an invitation. I walked into a room of a clinic where the patients had been arranged for us to review. There were 300 patients, all with unrepaired clefts, aging from 2 months to about 80. And I found that quite confronting to see so much deformity in one place, in one room. The biggest hurdles are really where you're going to perform the surgery and the standards within the local hospitals. That's why we always send a survey team over to look at what we need to bring and look at what's available locally. Things like air conditioning that doesn't work, operating on a table that doesn't go up and down, operating with lights that don't really work well, so we have to bring our own. They're all the little things. I think that the air conditioning in particular, when it breaks down, when the temperature's 38 degrees or more inside, is very difficult. All these situations can be managed, but it is just very different to what we're used to here. I think the way people can help the work of Interplast, it's obviously all about funding. It's obviously all about supporting the volunteers. So the volunteers have enjoyable experiences in terms of transferring their knowledge, if you want to put it as simply as that. But for all this to happen, there has to be a background of funding. Funding to run the office, which is not the good part of it, because people look very carefully these days at where their funding's going. If the funding just goes into a big administration, then it's not seen to be the right thing. However, it is necessary these days with all the regulations and requirements that we have to do to be a charity, costs money. Funding for the trips is terribly important. They're run on bare bones with a lot of volunteers. We have a lot of support from some of the big drug companies in providing some of our materials more cheaply.